So is rock climbing good enough for weight control and weight medicine? The answer is it just really depends, because if you kind of look at this, completely anecdotal, but all the really good rock climbers are like thin people, right? Because they're probably just burning so many freaking calories that they probably need to eat more carbs. But if you're not into rock climbing, do we have any medical evidence that rock climbing is sufficient for you to control your weight? I'm not aware of any of those studies. Now, I've had a couple of my patients who have unhealthy weight. They were not rock climbers historically. They didn't grow up that way, and they became rock climbers, and I found it was insufficient in that one case of keeping their weight under control. Okay, so that's a number and a one. I wouldn't base too much off of it, but that is a data point. I'm always open to the idea of what does the patient enjoy, what brings joy to their life, and see can we make it work. Because if you like doing it and it's physically active, it's probably gonna work, and you'll more likely continue that activity. So I try to craft the obesity plan around that, the obesity medicine plan around what that patient likes. So if they like cycling, let's go with it. And then there's ways to do that. Now, at some point, I might need them to do some squats because I want them to have more powerful thighs or thicker bones, right? And so I try to work with my patients to figure out what they enjoy physically and can we make it work. It may not quite fit the research data out there, but at the end of the day, the research data is a good starting point. It's a good idea generator, but at the end of the day, for each individual patient, it does become a trial and error. And so we just kind of say, let's go try it. Let's see what happens. We'll measure all the data points. And impressively, I did that in 2 minutes. I'll see you at the next video.